Hello, anatomy friends. This is Dr. Allsup, and in this video, we're going to be talking about the bones of the arm, and there's one, and as well as the two bones of the forearm. And you can see here I have lists of structures on those particular bones that I want you to be aware of. So kind of come back to each one of these, be able to tell where that is located, as well as why I wanted you to know it. Typically, there's some type of muscle attaching to it, or something along those lines, forming a joint, something like that. All right, so we're going to start with the bone of the arm, and there is only one. This is similar to what you will have in the thigh of the lower limb. And the bone of the arm is the humerus. All right, so you can see here on this skeleton, we have the one arm here. You have the kind of more bulbous proximal end. It gets large again in the more distal end, and then you have the middle shaft region. So we're going to start proximal and move our way distal. And the most prominent thing when you're looking at the proximal end is the very distinct head of the humerus. So you can see the head here labeled. Generally, it's mostly smooth because the articular cartilage would cover it during life. And this is the ball of the ball and socket joint, or the glenohumeral joint / shoulder joint. So this will articulate with the glenoid fossa or glenoid cavity of the scapula to form that glenohumeral joint. It's quite a bit larger than how much you have or what size you have of that glenoid fossa, so there's not a particularly great fit between the two bones. That will allow for more mobility at the shoulder joint, but less stability in comparison to many of the other joints we'll talk about. So much more to come in terms of the glenohumeral joint, but this is generally one of the more prominent things. It's also going to always be facing medially, because if you think about it, it always needs to be facing towards the scapula. There are two necks of the humerus. Generally, when you think of a neck, it's generally right next to the most proximal portion. And so when you're looking at the anatomical neck, it's going to be kind of right here, just distal to the head of the humerus. You can see it kind of right in here. So just kind of past that smooth portion associated with the head of the humerus. So that's the anatomical neck. If you continue distally, so kind of this space between the most proximal end and the shaft or the body, you'll have this kind of pinching in or a narrowing of the bone, and this is referred to as the surgical neck. So this is going to be just distal to the tubercles that we'll talk about in a moment, that are kind of on the opposite side of the head. And the reason that there are two necks associated with the humerus is because there needed to be a name for this surgical neck region, because, as mentioned, this is going to be kind of a constriction. It's necessarily a weaker area of the bone. And with weakness in a bone, this could increase the incidence of fracture. And that's certainly the case. This is one of the more common areas of fracture associated with the humerus. And you can see here on this illustration that there's quite a bit going on around this surgical neck. In particular, kind of wrapping around that surgical neck will be an important nerve, one of the terminal branches of the brachial plexus, called the axillary nerve. And the axillary nerve is going to innervate the deltoid muscle. And the deltoid muscle, you've probably heard of them as your delts. They're kind of sitting here right on top of your shoulder region, very important in terms of abduction of the shoulder joint. So if you have, say, fracture to the surgical neck, it could feasibly affect that axillary nerve, causing weakness or inability to be able to abduct, or some of the other actions that the deltoid muscle plays a role in. So a lot of times thinking about those anatomical relationships, is something close to another structure? Well, if something happened to one of those structures, it could affect the other one. And this is a really good example of that. All right, let's return to those tubercles that I was mentioning. So here again is that head of the humerus that's always going to be facing medially. And kind of opposite to that is this kind of bump that's always more laterally facing. And this is the greater tubercle. It is greater than the lesser tubercle, which is more anteriorly placed. So this is the greater tubercle is larger than the lesser tubercle, and that is because you have more muscles attaching to the greater tubercle than you do the lesser tubercle. So 3 of the 4 rotator cuff muscles, you can see that kind of those rotator cuff muscles here coming to attach on this greater tubercle of the humerus, whereas you only have 1 of the rotator cuff muscles, the subscapularis, attaching on the lesser tubercle. So anytime you have a tubercle, its size depends on how many muscles are attaching to it and how much those muscles get used. And then in between the greater tubercle and the lesser tubercle, you're going to have this fairly distinctive groove. And this is called the intertubercular groove. Sometimes you hear it referred to as the bicipital groove. And this is going to house, during life, the long head of the biceps tendon. I'm trying to see if you can see that here in this image, and I guess you kind of can see where that would be right here. So the long head of the biceps tendon is going to traverse this sulcus on its way to have its attachment on the scapula. Additionally, you're going to have the latissimus dorsi muscle, which is going to be a superficial back muscle, but its distal attachment's actually all the way over here in this intertubercular sulcus of the humerus. Thus, the latissimus dorsi will actually play a role in terms of movement of the shoulder joint. So you're going to have 2 muscles that are associated with this intertubercular sulcus, so quite a bit going on in terms of muscle attachments in this small region, which makes sense. These muscles, when they contract, are going to move the shoulder joint because this is so closely related to that region. Okay, now let's move distally. So here is that proximal end. Then we're going to have the body or the shaft. And then we're going to be talking about this more distal end. And one of the most prominent things you can see here are these regions referred to as epicondyles. So this bottom portion here is a condyle, meaning it's going to play a role in terms of articulations with certain joints. The epicondyles are going to kind of be above or associated with these condyles. You'll have a lateral and a medial epicondyle. As you can see, the medial epicondyle is significantly bigger or more prominent than the lateral condyle. The medial epicondyle is going to have the flexors of the forearm. So on this anterior side of your forearm, they're going to many of those muscles are going to have their proximal attachment on this medial epicondyle. Whereas the muscles on the posterior side of the forearm are going to have their proximal attachment on this lateral epicondyle. So though the anterior side, these are the kind of flexor muscles. They'll play a role in terms of flexions of these joints, whereas the posterior side of the forearm are going to be the extensors. So they'll play a role in terms of extension of the wrist, as well as some of the joints associated with the hand. Now, when you're trying to identify the difference between the two, well, first off, the medial epicondyle is always going to be larger, but also keep in mind that medial epicondyle is on the same side as the head of the humerus. The head of the humerus is always medial, and the greater tubercle over on this side is always lateral. So sometimes those things help me when I'm trying to get organized there. And then down to this condylar region. So sometimes these surfaces of the bones are just called condyles. In the humerus, they do have 2 separate names because they are, in essence, forming 2 separate joints. You're going to have the capitulum, which is on the more lateral side, and you'll have the trochlea on the more medial side. The capitulum is going to articulate with the head of the radius, whereas the trochlea is going to articulate with the trochlear notch of the ulna. So this trochlea and the ulna are forming that humero-ulnar joint, which is the main joint when we think about the elbow joint, so being able to flex and extend. So both are important, but this trochlea is playing a bigger role in terms of those prominent movements that can occur at the elbow joint. Another very prominent thing is on the back or the posterior side of the humerus, and this is the olecranon fossa. So you can see that medial epicondyle right there, And you can see the lateral over here. You can see a bit of the trochlea right here. Again, this is one of the most prominent things. If I'm looking at a humerus and I'm trying to figure out if I'm looking at an anterior or a posterior view, well, this posterior view will have this prominent fossa on the back. And what this does is it accommodates the olecranon portion of the ulna, as you can see here, during full extension of the elbow joint. So when you have this is flexion and this is extension. And so you have that olecranon fitting into this olecranon fossa during that full extension. During flexion, it will move away from it. So let's talk a little bit about the ulna. The ulna is the longer, so the ulna and the radius are your forearm bones. So you have two bones associated with the forearm. This will be the same as what you have in the leg. You'll have two bones there as well. Ulna is going to be the medial bone. This is the longer bone, and it's also the more stable bone. The radius will rotate around the ulna during pronation and supination, and more to come on kind of what that is when we talk about the joints. But let's talk about a few of the structures here. All right, so when we're looking, so this is going to be more proximal, this will be more distal. The olecranon is what we were just discussing over here. So this olecranon is what's going to fit in that olecranon fossa. Sometimes you hear it referred to as the olecranon process during full extension. So this is a very prominent structure. If you put your elbow, say, on your desk, it is resting on that olecranon. And sometimes you hear this referred to as the point of the elbow. This is so robust because you're going to have the attachment of the triceps brachii. So these triceps muscles on the posterior side of the arm are going to have their distal attachment on the olecranon of the ulna. Another structure that's not quite as prominent, it's going to be kind of more anteriorly projecting, is the coronoid process. You're going to have the brachialis muscle, which is really the workhorse in terms of flexion of the elbow. Biceps brachii gets a lot of the glory there, but it's really brachialis that does a lot of the work. So the brachialis muscle is going to have its distal attachment on this coronoid process, which is kind of at the end of this trochlear notch region right here. So the C-ish shape I'm making right here is the trochlear notch. And that's what's going to be kind of moving around the trochlea of the humerus. So that movement of flexion and extension is facilitated here at this trochlear notch. One other structure I want to point at, so basically all the structures I want you to know are on the proximal side of the ulna, is this divot right here, referred to as the radial notch. And this is going to be, and you can see this focused in right here. This is going to be right here where you have the articulation of the ulna and the radius. So the head of the radius articulates with the radial notch of the ulna. And this is going to be one of the first of the three radial ulnar joints. So there's three separate joints where the radius and the ulna are going to articulate. So more to come regarding those, but you can see kind of that relationship right there. The distal end of the ulna, there are structures there, none that I'm going to have you identify. It is not nearly as prominent as the proximal end, and that's because as we get more distal associated with the ulna, we're not going to have that close relationship with the wrist or the bones of the carpus region as we have with the radius. So you'll see here that the radius actually gets larger as it moves more distally, and that's because the radius will play a bigger role in terms of the wrist joint, whereas the ulna will play a bigger role in terms of the elbow joint. Okay, so let's talk about that radius. So whereas the ulna is the medial bone, that means that the radius is going to be the more lateral bone. It is shorter. Again, it's proximally not as robust, not playing as huge of a role in terms of the elbow joint, but you can see that it gets larger the more distal you get. And so that is going to allow on this bottom portion here an articulation with the proximal row of the carpal bones to form the radiocarpal joint or the wrist joint. When you're looking at the more proximal end, you do have this fairly distinct kind of discoid shape head. And this is what's going to articulate with that capitulum of the humerus to form the humeroradial joint. It also is going to articulate with the radial notch of the ulna. So this side is more articulating with the radial notch, whereas the very top portion of the head is what's articulating more with the capitulum. And then right here, one last thing I want you to be able to identify is this bump just distal to the head. This would be the neck region of the radius, and this is called the radial tuberosity. It's going to be medially projecting, and it is going to be robust because this is going to be the distal attachment site of the biceps brachii. So the biceps brachii is this more superficial muscle of the anterior arm, and it's going to distally attach here at the radial tuberosity. Now, there are going to be a few clinical correlations that I like to discuss, particularly if they're more common. And one of the more common injuries that you can have associated with the forearm is what's referred to as a Colles fracture. And this is going to be a complete transverse fracture of the distal, kind of the distal portion of the radius. So you can see there's a fracture line here. Generally, what will happen is this more distal fracture part will be displaced more posteriorly. So you can see kind of that bump that shouldn't be there, kind of projecting more posteriorly. And again, this is going to be one of the more common fractures or common injuries associated with the forearm. This often occurs with a forced extension of the hand, and this can occur with that mechanism of injury of falling on an outstretched hand. So again, when you're falling, you're going to protect, other components of your body, particularly your head. So you're going to put out your hand in order to break the fall. And how you fall on that hand can have implications. Either can directly fracture the bones that you fall on, or can transmit force up to other bones of the body. And one of those particular injuries that can occur is right here on the distal radius. This type of injury is more common in individuals that are older than 50 years old, and even higher incidence in individuals with osteoporosis, because this distal end right here of the radius has a higher degree of spongy bone associated with it. So if that is going to be compromised, like what can happen with osteoporosis, that could cause or increase the incidence of fracture in this particular area. So one of the more common areas in terms of fractures, particularly in this set of individuals. All right, excellent. So we have reached our question, and I'd like for you to see if you remember so the olecranon fossa of the humerus articulates with which of those two forearm bones? Is it the radius or is it the ulna? So key, the olecranon fossa, we know that olecranon fossa is of the humerus, and it articulates with which of these forearm bones? So which of these bones has a structure referred to that's called the olecranon? Well, it is the ulna. So the ulna has that olecranon, or this point of the elbow, and then during full extension, that olecranon will kind of sit within the olecranon fossa of the humerus. So ulna is the correct answer. Radius is not the correct answer. All right, excellent. Thanks so much for your attention here. So we've talked about the arm and the forearm. So now let's get to all these smaller bones that we have in the wrist and the hand. I'll see you in the next video. Thanks.